Hi, and welcome to my poster presentation. My name is Emily Gagnon, and my project is titled Beyond Access, Exploring Information-Seeking Behaviors of Low-Income Users. Today, I'll be sharing my key findings from my research on low-income users, and specifically focusing on residents in Venango County, Pennsylvania. I'll be discussing evidence-based strategies for improving library services to better support their information needs. So I'd first like to explain some context. My user group is low-income residents in Venango County, a rural area where approximately 6,778 individuals live in poverty, and this deeply affects children and seniors specifically. For many residents, the public library functions as a critical access point for internet and technology. It serves as a community hub and a supportive environment for completing essential tasks like job applications, school forms, and accessing health information. However, research shows that growing distrust of institutions can influence how low-income residents interact with public services, including libraries. This context is essential for understanding their information behaviors. So my research found four major patterns of information behavior for this user group. First, many rely heavily on interpersonal networks. This can be family members, neighbors, friends, and even social media before turning to formal institutions like libraries. Secondly, users engage with institutions, including libraries, only selectively, usually only when required for official information needs. Third, their information seeking is often pragmatic and urgent, driven by immediate needs related to employment, housing, or even crisis situations. Finally, low-income residents use a range of adaptive strategies, often working with limited digital access, low literacy, or unfamiliar systems, and finding their own ways to bridge gaps in understanding. The two theoretical models that grounded my work were Chapman's theory of information poverty and Dervin's sense-making approach. Chapman explains how marginalized groups form small worlds with their own norms and trust boundaries. This explains why some users avoid formal help at the library. They fear judgment or stigma or have past negative experiences that can all act as barriers. And then Derwin views information seeking as a process of bridging gaps. So users take steps to move from confusion toward understanding, but if the system doesn't meet their needs, they may disengage. This lens helped me think about how library services can better support that gap bridging process. So, across the literature, I identified three categories of barriers that shape the information behaviors of low-income and rural residents. Social and cultural barriers was number one, and that included fear of judgment, stigma around help seeking, and low trust in institutions like libraries. These barriers directly influence whether people feel comfortable approaching librarians for assistance. Second was a digital divide, and this includes internet access but also goes beyond that. It also includes limited or outdated devices, having low literacy or low digital literacy, and difficulty navigating online systems. These factors create friction when completing required tasks. Third were institutional barriers. Staff are often put in positions where they have to serve as de facto social workers without any specialized training. Libraries in rural areas also face limited funding, staffing challenges, and misalignment between offered programs and what the community actually needs. Together, these factors shape how users seek information and how they experience library services. To address these barriers, I identified four evidence-based strategies grounded in both scholarly research and practical examples from public libraries. First, we're introducing peer navigators or trusted intermediaries. Research shows that users respond positively to assistance from people within their own social context. Peer navigators help bridge trust gaps and reflect interpersonal information patterns. Second are multimodal low literacy resources. Libraries can improve access by offering visual guides, audio instructions, bilingual materials, and simplified steps for common tasks. This can help reduce intimidation and increase digital confidence. Third are conversational gap bridging reference supports. Inspired by Dervin, this approach uses step-by-step, user-centered support. It acknowledges confusion and normalizes the learning process, helping patrons build understanding at their own pace. Given the emotional and social stress many patrons experience, I also think it's important to have trauma-informed staff training. So staff can be trained in empathy, boundaries, and trauma-informed practice, and that can help improve interactions and reduce fear of judgment. So for my expected outcomes, these strategies can lead to several meaningful outcomes, including increased trust between patrons and the library, higher engagement with library programs and services, improved digital and information literacy, reduce social and structural barriers, and greater autonomy for users navigating complex systems. Ultimately, these changes can help libraries better align with the lived experiences and information behaviors of low-income users. Thank you for taking the time to view my poster, and I'm looking forward to reading any comments that anyone might have. Thank you.